Hi, I'm David Shank.
Nice to meet you, Max Wallack.
Hi. Mac, you say your name again.
Max Wallack.
Great to see you, and tell us about your connection to Cure Alzheimer's Fund.
So I was on the planning committee for this event this year, and I've sort of been involved in doing a lot of other help planning and things for this organization in the past.
Thank you for that.
Thank you. And I'm very focused on sort of helping bring an end to Alzheimer's and through research and through patient support and caregiver support and through non-pharmacological treatments for Alzheimer's patients.
How did you first get drawn to either Alzheimer's or Cure Alzheimer's Fund in particular?
So my great-grandmother was diagnosed with Alzheimer's when I was 6, and I became one of her primary caregivers. And through my interactions with her and through sort of what I saw her go through and what my family went through, I really realized that what I need to do in my life is help these patients and help their families. And so a few years after she passed away, I founded a nonprofit organization called Puzzles to Remember, and it collects and distributes jigsaw puzzles to facilities that care for Alzheimer's and dementia patients. And so this organization has collected and distributed over 35,000 jigsaw puzzles.
Wow!
And sent them to 2,500 facilities across the world. And we've also collaborated with a puzzle manufacturer, Springbok Puzzles. It's based in Missouri, and they've actually made a special line of puzzles for Alzheimer's and dementia patients, which have sort of smaller piece number and larger piece size, so they're more accessible for people with advanced Alzheimer's, but also have themes that are very calming and memory provoking, and can be used to really enhance a sort of the quality of life of Alzheimer's patients. That's what the whole project was for. And then also for the past 3.5 or 4 years, I've been involved in doing Alzheimer's research. And it's been very exciting in what we've been doing, because we've published several papers stating that there's a hormone that's already found in people that can be potentially used as both as a test and as a treatment for Alzheimer's. And we started looking at this sort of hormone in people originally. We had this large sample of people who either were healthy controls or had Alzheimer's or MCI, and we saw that there were changes in the levels of this hormone and its correlation with serum amyloid beta. And so we sort of thought, what could we do with this? And we took it into mice. We started going into transgenic mice, and we've looked at the ability or the injection of one dose of this hormone will actually have this large increase of amyloid beta in the serum. So we are able to sort of, after even in a doctor's office, you could have like a shot, and then you could sort of, a few hours later, you could see if somebody has elevated amyloid beta in their brain. So it could be very useful in diagnosis and in sort of having cheaper and more effective diagnosis.
Sorry, so what sort of scan would you need to see that in the brain?
You just give this as an injection, and then you take their blood. You don't need any brain scans. It's very quick and very easy test. It's kind of like a glucose challenging test in diabetes. So it's very exciting work that we've worked on. And also we moved, if we can get amyloid beta out of the brain after one injection, we thought maybe we could do this over 2 months, inject these mice with this drug for every day for 2 months. And we saw this sort of reversal back to control behavior, so they act completely normal on mazes, and they have a very large reduction in the amount of plaques they have in their brains.
So how soon could that test get to market?
So there's already actually an FDA-approved drug that's an analog of this hormone. It's called pramlintide, and so that if we've already started a few clinical trials, and we want to continue doing more larger clinical trials, and if these work, it would be very quick because it's already available on the market. So it's very exciting.
Wow. Well, congratulations on that, and thank you for saying hi and telling us about your connection here. All right, thanks.